they're out there, because I was seeing them as patients. And the patients were saying, you've helped me a lot, but boy, I've got these people out on my service in my hospital, and boy, they could really use you, but they're scared. And how do we get them help?
Hey guys, this is Dr. Mike Luming. Welcome to another edition of BootstrapMD. We're continuing to interview the movers and shakers in the physician coaching industry, and I'm so happy to have my next guest. She's a board-certified psychiatrist and integrative physician. She's over 35 years experience caring for patients, many of whom are medical doctors. She's a multiple certified personal and executive coach, and who works with physicians who are suffering, but maybe not are sure that they're even a patient. She's the founder and CEO of Wholehearted Doctoring. It's a practice devoted to restoring humanity, clarity, and compassion in medicine and in the world. And I'm so excited to have her. And since I've gotten to know her, she's actually has a very good sense of humor, which I really appreciate. So why don't you welcome to the program, Dr. Pam Pappas. Pam, how are you doing?
Oh, it's a beautiful day in Scottsdale right now. And of course, all of us are so happy because it was up to 120 in the summer this year.
As we talked about, I did my residency over at Mayo, Arizona back in the 90s. And I remember pushing my now 24-year-old in a stroller at 10 o'clock at night, because that was the only time that was sane enough to be there. And there was like me and 100 other couples out there pushing their carts too. But it certainly was a great time to be in Phoenix. It's just a beautiful area.
Thank you. No, I'm so happy to be here with you today, Mike. Thank you for inviting me.
So let's talk about it. As I mentioned, this podcast, we have in our audience physician entrepreneurs, many of whom want to become a coach, and they said it's found it helpful to follow people who've already gone through the steps and gone through it. So let's talk about your journey on how you became a physician coach. You started out in psychiatry, and how did you end up being involved in coaching?
Yeah, and how did it morph? Well, I started out my career seeing medical students who would come to me surreptitiously, even when I was a psychiatric resident. So I have a long and storied career with assisting my colleagues. And the thing is that I ended up developing a mental health service for medical students and residents, beginning when I was a resident. But then by the time I was done with my residency in psychiatry, I had about 25 of these people who were coming just wanting for help during their training. So I was approached by the chairman of psychiatry and the dean of the medical school. This was East Carolina Medical School. He said, "Pam, you can't leave. We gotta make a job for you." And kindly, I said, I'll sign on. And I developed and kept running for the next 12, 13 years, this service that kept growing and growing and growing. So this started, way back when. But the thing is, helping my colleagues as a psychiatrist treating patients has never not been part of what I do, no matter where I went. Academically and academic services or geography. But I noticed that not everybody needed to be a patient, meaning a DSM diagnosed condition that required medication or whatever. I was an excellent therapist and got a great deal of fulfillment in helping him move forward in that kind of way, unraveling long-term conflicts and relationship troubles that were being revisited in their current life. But I knew there was a ton of people out in the world that were suffering, that either they didn't need to be patients, or they were scared to be, or that they thought there was going to be some kind of licensure repercussions if they did, or lose prestige. So about a decade ago, I started saying, okay, I'm gonna gather some more trainings in coaching, and I'm going to make myself available to this more population of my colleagues that's out there. I know they're out there because I was seeing them as patients, and the patients were saying, you've helped me a lot, but boy, I've got these people out on my service in my hospital, and boy, they could really use you, but they're scared. And how do we get them help? So the coaching, I started out with a brief course that, I don't know, I guess that was about 3 months. And it had a lot of neuro-linguistic programming and various kinds of attributes to it. And I learned some, but I was very aware this was not the whole enchilada, and that I needed to do some more. So I went on and I worked with the integrative health coaching people at Duke Medical Center. This is before the University of Arizona created its. I got certified as an executive coach through another school in Sarasota, Florida, the Center for Executive Coaching. And then I noticed that you can't separate what's going on in the office from what's going on internally, personally, with the physician themselves. So I went to the College of Executive Coaching, which blended the two. So it's a personal coach and an executive coaching. And these were much longer and deeper and more, shall you say, variety, more extensive, additional trainings. So I guess my desire to make myself the most accessible and skilled in various ways, some things that I had never heard of. I didn't even know about emotional intelligence before I went into coaching. They didn't train us in that stuff in psychiatry or anything else. And I was just going, well, I could have used somebody helping me with this when I was a resident, or when I was an early faculty member, or when I was trying to negotiate my way through some of these promotions or, tenure committees, which I have been through. All of this was just huge. And it's like my eyes were opened, and how do you combine this? So the more I learned, the more excited I got. There have been some coaching trainings that I entered and then stopped because I could see that this was not the way I wanted to work with my clients. And so I got more discerning along the way. So it's been an adventure.
Yeah, it amazes me that, some people think this physician coaching is a recent phenomenon. You've been doing this for some time. If you can remember back then, about when you were working with since like residents and they were just kind of doing it on the side, what were the issues that they were discussing? Was it much different than it is now?
Oh, that's an interesting question. Back then, when I started this would have been 1983 when I started the service. And the term burnout was not being used so much. That was a freshly developed term, maybe in the mid to late 70s. And so the people were, and it was medical students, residents, and some of the faculty from other services were sneaking in because
Quietly hiding. Right.
Well, yeah, but because they heard that I was reasonably compassionate, somewhat sane, and approachable. So they're at all levels of training, and they're talking exhaustion, they're talking dread to come into work, even though this is what they have worked hard to do and to become. They were feeling like they were kind of like cogs in a machine.
Mm-hmm.
All of these things that they were talking about then is similar to what they talk about now, only people call it burnout, people call it moral injury, moral distress. And the three primary criteria of burnout, the exhaustion, the loss of compassion, and the feeling of inefficiency are well known to most physicians now, based on what you see in the social media and what you hear talks on at almost every medical organization, conference meetings. So they're used to it, but they don't sometimes that they don't understand that this translates to themselves. It's not just their friends. So the issues, I think, were similar. They just called it different, or they didn't recognize it in the same way as we do now.
As a doctor, I wasn't used to asking for help, especially when it came to subjects outside of medicine. But then I found physiciancoaches.com. In an instant, I found hundreds of experts to help me in all aspects of life. On areas I was afraid to ask: dealing with burnout, starting a side gig, money management, even help with my marriage. And the best part? Nearly all experts are physicians themselves. After reading their profile and a quick chat, I knew I found the right mentor for me. At physiciancoaches.com, help from professional colleagues is just a click away.
Well, now, it seems, hopefully, that, mental health is now more out in the open. When it sounds like when you were working there, it was just like, hey, you help them so you can fix them, and then they can get back into the workplace, which I guess is not so much different it is now, but at least now, you know, mental health is more out in the open. Would you agree or disagree?
Well, that's another good question, Mike. First of all, I don't regard myself as fixing anyone. And that would be one of the first things that I would talk with if somebody came in as a patient, I would have a chat with them about. But the idea of getting them better so they can go back out into the battle, quote unquote, is not unlike military medicine. Mm-hmm. Oh, you're having trouble on your surgery rotation. The attending surgeon is a real schmuck, and he's doing this. Or in some cases, it could be a woman surgeon. We had those at the.
They call them disruptive physicians.
Well, now that was not a term then. They had other kinds of more colorful descriptions for these people. Well, schmuck would be one. That can be said, but there's one that begins with A and ends.
Right.
That I probably better not say, even though I would normally use that. But so they called it something different, and the student or the resident or if it was a faculty, they would be running into how to deal with this. And most of the time in working with me, they would get really clear about, oh, wait a minute, I can think about this in a different way. I can learn something about myself, or this is not, in fact, my earlier situation. This is a person who's sick. And do I want to get out of this situation or, stay in it? The same kind of questions come up for people now, only a lot of them don't seem to consider that they have a choice about what to do. Once they get aware of all the suffering that's inside, and that they actually do have some agency to make a move or to try to negotiate changes in the job that they have. They wouldn't have ever considered that before. Most of them have never even asked themselves what they want. As practicing physicians. They just got their heads down and, doing crisis management,
Right.
I mean, the cartoon comes to mind, the train's going and it's got a cow catcher, that pointy thing on the front, and it's going down the tracks and things are flinging out of the way. That's kind of the mode that some of these people are in, and they're just trying to make way,
Right.
in any which way they can.
I'm dating myself, but it reminds me like when we're in residency and we had these things that my son knows nothing about called beepers. And
God.
you would have to take when you would hand the beeper on, or you would turn on the beeper, and that's when the fire start. And you would work for that 24-hour or 36-hour period until you're able to turn off the beeper or hand it to your fellow resident. That's what that kind of reminds me of. And it gets to when you're saying they're not even sure what they want. I think it's a good transition to what you're known for as an expert in is just discussing about self-compassion, about having insight into yourself. What is all that about, and how does that relate to what you see as in the culture of medicine?
Wow, that's a big question. And just before I get into that, I just want to acknowledge your creativity and what you've done with your career and figuring out what you wanted and what was important to you and making the shifts and the changes that you've made. I had admired your work and you as a person for doing what you did for many years before we ever met. And
also crazy, but
yeah, it can look like that from the outside to somebody else saying, "Well, what's Wu Ming up to?" Or Pappas. Now, when I decided to do more integrative training,
yeah,
the chairman of my department in psychiatry just happened to be the president of the APA at the time, and he thought I was friggin' nuts for leaving and going and doing this. But it was like this little, I don't know, this little beacon inside of me that knew, hey, I need to do this, even though it looks Looney Tunes. So you asked about knowing yourself and what is the self-compassion business anyway. If you're in crisis mode, the last thing you're going to do probably is ask yourself, what do I want? Because that takes additional bandwidth. You're dealing with that beeper and it's going in what I used to call beeper epilepticus, because it kept on beeping no matter how many phone calls you answered or emergencies that you fixed, because you're supposed to fix them.
I set it to vibrate and use it as a self-massager for the neck.
I once got so mad in the emergency room because the nurses kept calling me in the emergency room, even though I was in the emergency room seeing the people that they were calling me about. Yeah. I came in and I threw that beeper. And I thought, against the wall, but not, at anybody. But that was how impacted I was. Right. I was really, you talk about looking crazy. I was looking crazy. And that is the epitome of unself-compassion. That is the epitome of somebody that is not taking in what they need in order to live. Like maybe it had been hours since I went to the bathroom or had anything to eat, but I was just pissed because I felt like they were doing things to me and that I was being brutalized by the system and I was defending myself.
Mm-hmm.
Now, had I had some self-awareness, some self-kindness, like I would say, if you were telling me that you were going through this, I wouldn't yell at you more. I would try to find out what you needed. But
Right.
that's not how I was treating myself. So self-kindness, treating yourself like you would a good friend, if you could see them, they're erupting or they're crying or whatever that they're doing, or their child has got something wrong and you need to help them. And then to recognize that I'm not the only one in the world that has this kind of suffering. It's a common humanity. Like, this is a moment of suffering, or this is sheer shit.
Mm-hmm.
There are 6 psychiatry patients in the ER that all of them have something important and noisy and psychotic and needs to be dealt with. But the nurses are calling me from the front desk, interrupting me from doing that which they're calling me to, hurry up and do. And I don't have any backup.
Right.
So what I needed and what I didn't know then at that particular job was how to calm myself, how to tune in, how just to put my hand on my heart and just breathe for 30 seconds. Now that would have helped, but that didn't even cross my mind. I just come to battle and I'm throwing the beeper. Of course, that was really charming, and I'm sure that that got me written up in the program. So self-compassion is an attitude of self-kindness and awareness, and also mindfulness of what actually is happening. Now, those nurses were not purposefully giving me a hard time. They had a crowded ER of people that had various kinds of extremists, and they needed to have things move along. They were also in Eastern North Carolina and not very comfortable with people that weren't acting right. And there was a prejudice and a stigma against that. And so some of the things that were going on in them were being visited upon the situation. But it wasn't them being purposely against me. And I didn't see it. So I misinterpreted the whole thing and got aggressive back. If I had been more mindful, I would have seen the thing from a whole systems perspective, which I did not at the time. I just saw my own, little needs, and which I had a right to.
Right.
But the thing is, I guess I was you've heard of mindfulness-based stress reduction. I was mindless-based stress production. Basically, is where I was.
Opposite, yeah.
I was the exact opposite. So I was being unmindful. I was being unkind to myself, and I felt like I was totally alone. I was the only one being brutalized in this particular way. It's true, I was the only one on call for psychiatry that night, but there's other people having trouble too.
Yeah, you definitely need to have insight, just as when I was in primary care and we would have 40 patients who would come in that day, and you have 40 different, you don't know what you're getting in those 40 people that are coming in. And I would have some who are aggressive. I've had a few who've been confrontational. I mean, those are the exceptions of the rule. And, they're upset about something. But having insight is to almost like putting yourself in that bubble and saying, hey, what's going on? There's something that is going on with you. And maybe they've never been asked that question for that day. Like, why are you upset? What is this? And it could have been something small. It could have been something big. I saw that in my residency program where, I firsthand, it felt like I was getting bullied by a second year resident in Maricopa when I was doing my OB rotation. It was very toxic and very, demeaning. But for me, it was about, okay, what can control? Well, one of the things I can control is getting good with the nursing staff and getting good with, people who I could get to be my ally. And believe me, they all have the same kind of traits too. But if you're able to have that insight, that compassion, and realizing that they also are having this thing that is done to them, and for them to, it's that circle of abuse almost, right? Like they were abused before, and then they feel that they can abuse you.
Well, that's the thing. And when you asked the piece about medical culture, that's what happens, because when we're mindless based stress producing people, producing people, we don't recognize we don't have bandwidth to recognize the situation of the other person that we're with at the time from that larger perspective. And instead, it's a very common reaction to identify with aggressors, so to speak, who have done things to us in the past. Yeah. And it may be unconscious this is going on, but we end up doing it to somebody else with less power in our group, like a resident that's younger than us, or a medical student, or God forbid, the patient. Mm-hmm. Oh, that's a frequent flyer. Right. Oh, or this, they're back again, and they aren't really sick. And watch it. I mean, sometimes that person is the one that shows up with the diagnosis that puts everybody to shame. And I've seen this happen so many times. But we do this knee-jerk reaction of spewing out you said toxicity, a toxic thing against other people. And then those other people carry it forward, because who are they going to, spew it on? Somebody that's lower than them. And then when they become supervising residents, well, it's my turn, because I got the attending or the chief resident and the attending on my case. And so that pressure mounts, and then the junior residents get it and the medical students get it. There's the frequently told story of people in the OR and having to cut sutures off. Well, would you like it too long or too short? The medical student will ask, because there's nothing you can get right.
Right.
Because this medical culture thing is happening.
Yeah. And for me, I think what helped me was one, finding a common interest with them, either, something outside of medicine. Like, I remember at the time, like my wife was pregnant, so I was asking them, like, hey, what baby stuff should I be purchasing? And just getting them, getting them on a human level. And then for me, I like to use humor, as you do, hey, we're in a really, bad situation right now, but hey, let's talk about how bad the food is, or, or something where it's like, hey, this is quality gourmet food, and just using that as a way of kind of deflecting it. But, it's hard to.
I hear you. I'm interrupting because I hear you say deflecting, but I also hear that it's connecting.
It is connecting.
You're connecting with that other person. And you said finding a common interest. That's not necessarily in this fray of medicine right now.
Because for me, I'm talking about this back in the 90s, and we're reflecting. It's like, I don't need you to be my friend, but I need you. I'm here for the next 2 or 3 months, and we're here to help these patients. And I don't need more. Yes, you're as you put, an a-hole, and you're here for this time of period. But I can leave. I'll be leaving in a few months, and I know that this is just a temporary part of my life that I just need to get through. But that takes insight, as you said, but there are people who I know who still have PTSD from their residencies or their programs. And for me, it was always about, this is just a temporary part of my life. Even in your own job that you're in, you can always quit your job.
Well, that's because you had more bandwidth. You were healthy. That is. I mean, people will say, "God, you're crazy. You're doing this other kind of business thing," but actually, you had some perspective, and that matters.
Not all the time. Not always. Yeah.
I'm not saying you're perfect, for sure. I wouldn't. I just told the story of throwing the doggone beeper.
Right.
Now I'm not always like that, but that was like one of my low points.
Right.
In my life, I thought I need some help.
So we and I want to discuss when you see a client or a new client, you talk about how you use Enneagrams to evaluate them, and maybe, like you said, I have more bandwidth. How do you use this? First, what is an Enneagram, and how do you use that to help your clients?
Well, the Enneagram is a very, very ancient system that looks at what are the basic patterns that humans do that get them through life. And the thing is that it starts from the idea that we are spiritual beings in human form. So it's take a step back from when you became Dr. Mike Wu Ming or, Pam Pappas. Here's how we're showing up today. We have kind of default positions of personality, behavior, emotional, mental patterns that help guide us through life, but they can get us into a jam when we bump up against somebody who's opposite to that. And you can get into a conflict about, well, now, wait a minute, I'm in charge and you're acting like you're in charge. And so you can see how some scuffles would happen. Well, the Enneagram is a way of understanding that and starting to get to know what is your fallback position when you're too tired or you're stressed. And are there any other ways of dealing than that? And is there some way to see how healthy or unhealthy you're seeing the world and yourself based on some of this work? And so a person can start with a basic online exam assessment, rather, and that's been validated quite well, called the Ready. And I can start there, and the person reviews the results that came, and we can start a discussion. Well, does this ring true for you? Some cases it doesn't at all. And it could be there a little glitch with the numbers. But studying some of the closely related patterns, they can find something that, now this is more like what I'm motivated to do or why I'm doing what I'm doing. But the idea is that really it gets them to look at their own internal makeup and what is the effect of, what's it like being on the receiving end of that? What might it be like? Oh, my wife's always complaining that I do, XYZ. Now I see why she says that, because she needs this other kind of behavior in order for her to feel like things are normal. So it's really a starting point. It's not like a pigeonholing or a defined thing. But the Enneagram, another reason that I like it is that it also provides a pathway for someone to move past their patterns and get some space between what they typically do and what they spontaneously would like to do. And it can be very different. That you want to get the most creativity and excitement in that you can, and or to feel like you're living your life. And that's one of the things that I work with them on.
We have so much we could talk about. The time is just going so quickly. I want to talk about your programs because we discussed this. About there's a lot of coaches. They've got group coaching programs that work for 3 months. You prefer to work one-on-one, if that's fair to say, and for long periods of time. Tell me why, and what type of person would work best with you.
Well, okay, so the reason why I prefer to work one-on-one is so that I can individualize the work as much as possible with what a given person needs. And that can vary depending on the level of training that they're in. I have, or level of experience that they're in. Sometimes I've worked with people at all ranges, from freshly out of residency and now they're in a new primary care practice and sweating it, to all the way to, gee, I'm ready to retire, but I'm scared because I don't know who I am if I'm not Dr. So-and-so. And, how can I survive this? So you can't put both of those individuals in the same pot and expect them to come out with the result that they personally are looking for. So I really want to get very clear with them to start with about what it is that they want, what is the growth that they are looking for, and decide, okay, what's it going to take to get them there, and construct something that really, I think, is going to give them the best running start. So I also don't do just one-off. Can I just get a coaching session from you? I just need one. I'm going, well, we could, but in the scheme of things, in the scheme of the depth of your life, that may be like a little dip a toe in the water. And I know that that's not going to be in the long run in their best interest, because I've done both. Myself, I've been coached in a shorter program and then a longer term one-on-one, and I could see what happened with me. In terms of the person that would be best suited to this, is if they really are interested in understanding themselves. I don't know how many people have started like on a discovery call or I call them wake-up calls with my private practice, but they say, I feel like I've really lost my soul. And I'm bumbling around, and I don't even know who I am anymore. And so if they're wanting to find that and tap into what's naturally there, there's plenty there. There's more right with them than's wrong with them. I'm clear about that. They're probably more resilient. I know that they're more resilient than anybody ever said. But if they're feeling like that they're being made into a piece of machinery some way, and they're having that soul hunger, or wanting to connect with something that's larger than themselves that they used to think medicine would provide, then working together in a one-on-one way with me, I think, is useful. There's room for tears and all kinds of, and what my homeopath calls, well, Pam, that's a worthy piss off. There's room for all that.
Can you share maybe one or two success stories of who you've transformed?
Well, I'm not the one that transforms them. They transform themselves. And that's the thing. What I do is, I think, provide space for them to have their own insights and realizations that move them forward. And sometimes that happens during the conversation. Sometimes it happens a couple of days later when they're taking a walk with their dog, or they're taking a shower, and they go, oh, wow, that's what we're talking about. Or, yeah, well, I could do this. So one would be a woman who was an excellent family physician who also had training in obstetrics and C-section. And she's in a hospital system that had her on call in various ways, a lot more than any of her colleagues were. And she's wondering why she's tired. Mm-hmm. Because of that, head down, just do the work kind of attitude.
And the sound, yeah.
Yeah, and that you've seen yourself. But what ended up in our work together is her realizing, hey, this is kind of crazy. I would be, she was reluctant to give up the C-sections because it gave her a certain feeling of credibility, validity, specialness, which something, humans typically crave. But she realized she would be happier in a direct primary care practice that she owned and she did. And so by golly, that's what she did.
That's wonderful.
And very happy. And then there was, this is a little different of a story. A surgeon who was in a big hospital system, who came because he was working all the time. And it turned out that he had a history of sexual trauma himself and needed specific help with that. So I helped him find a therapist that could work with him while we were doing coaching. And he ended up balancing out a whole lot of what was going on. But he said, Pam, you know what? If I hadn't started with you, I would have never, ever reached out for specific help with this trauma. So they talked to me about this stuff. And then we work out together, okay, so what do you think can help with that? He came up with, do I need therapy? And I said, that's really a good idea. I wonder, so what makes you say that? He goes, well, I've thought about it. And because he was drinking and doing a whole lot of other things that were, he was trying to distract himself. Like you were talking earlier, he was trying to distract himself from the pain.
Sure.
And so he made huge progress in he renovated his life.
Oh, that's wonderful. Pam, this has been amazing. Again, we have to have you on another call. We have links where you can reach her if this sounds like someone that you would like to work with. Again, Pam, as far as I know, you're still taking in clients.
Glad to have them. Glad to talk with people and have a wake up call and see what it is. I've been through wake up calls of my own, so I'm happy to talk with people.
Well, we're at the time of the year where it's we often reflect. So if you feel like you're sleeping throughout the day, maybe it's time to call Dr. Pam for a wake up call. Dr. Pam, thank you so much, and thank you again for everything that you're doing out there.
Thank you, Mike. I appreciate it. You too.
Thanks, everyone. And as always, if you have these issues, don't try to bottle it up. Sometimes you need to speak to somebody about these issues. Research, find somebody that you connect with, and keep moving forward.